Good afternoon. I'm Dr. Mark Lobanoff, and I'm here to speak to you today about how the Zimmer Z8 can optimize your office-based surgery and LASIK surgeries. So, about 3 years ago, I decided to leave my practice. I'd been with the practice for 16 years. I wanted to break away, and what I really wanted to do was to build the best office-based cataract surgery and LASIK center that I possibly could. And so we first began finding a building. We wanted a beautiful building. We did find one. We're very proud of this building. The way that this building was designed is we have a complete LASIK clinic and a LASIK surgery suite. And we also have completely separate a lens-based area for refractive lens exchange, cataract surgery. They're separated, but we needed to have equipment for both. And we wanted the equipment to match the beauty of the clinic. We wanted the equipment to be the best of the best. And it needed to serve both the lens side and the LASIK side. And that meant a femtosecond laser that was up to the task of doing both. So we're going to see a little video here, just a very brief introduction of what our clinic looks like. So you get a sense of where we're working and where we're using the Zimmer laser. So we start with a little outside shot of our center. And here we're entering the LASIK side. We've been fortunate to be very successful on the LASIK side. Within 3 years, voted the top LASIK center in Minnesota. So you can see that the center is designed to be aesthetically pleasing. And here we can see one of the laser rooms. And at the center of the laser room for LASIK is the Zimmer Z8. On the lens side, we also want to have the very best of technology. And so on the lens side, we have a very similar aesthetic. Patients come in, and we decided we wanted to bring office-based surgery into our clinic. We felt it was a very important part of the future of cataract surgery. So we built this office-based surgery center. We think that, again, the aesthetics are wonderful. Patients have really responded to that. The procedures are done in comfort, safety, in our own office, and this has been great. But again, we needed the equipment to match this clinic. So I wanted to have a femtosecond laser that was best in the market. In my opinion, honestly, is that Zimmer produces the best femtosecond laser in the market, bar none. Why? It's based on physics. So what the Zimmer does especially well is it uses a laser that has an order of magnitude less energy per shot than a lot of the competitors. You might say, so what? What that lower energy allows us to do is to make smaller cavitation bubbles. And by making the cavitation bubbles smaller, we can overlap them. So one of the problems with conventional femtosecond laser systems is that the spot sizes are larger. With more energy, the spot size is larger, and they couldn't overlap the spots because if they did, too much energy was being applied and you'd have tissue damage and cellular death. So what the other companies did is they made these spots close to one another but not overlapping. And the problem is this creates tissue bridges. And the tissue bridges, and first thing is as you go to make that LASIK flap and lift the LASIK flap, you're running into that resistance. That's fine, but what really bothers me is those tissue bridges that are left behind are in a very organized pattern. And when you have a very organized pattern like that, you start to get some diffraction, and one of the side effects is rainbow hue. And I'm representing that here by that light source. So patients will say, okay, I'll see a light, but I see all these rainbow colors around that light. And it's because of these tissue bridges that are left behind. The beauty of the Zimmer is with less energy, you can overlap all the spots. There are no tissue bridges. So the first thing you notice is you go to make that flap and lift the flap, it lifts smoothly and cleanly every single time. The second thing, though, is without the tissue bridges, we never, ever have rainbow hue with our LASIK patients. And when you're building a premium LASIK center, you want premium LASIK outcomes. And the laser helps you achieve that. The other nice thing is there's no bubble breakthrough. So when you have higher energy and a bigger cavitation bubble, if you have a previous incision like an RK incision or a previous astigmatic incision or a scar, the gas and the energy can follow that weakness in the corneal tissue and you can get bubble breakthrough. You can get an opening of RK incisions, you can get bubbles in the anterior chamber. You don't see that with the Z8. The Zimmer lasers with less energy, smaller cavitation bubbles, they don't cause bubble breakthrough. I can make flaps above RK incisions. I can make flaps above scars. I never have to worry about the laser limiting me what I want to do in clinic because the technology is there to back up whatever way I want to use this laser. So it has a very low pulse energy, has a high pulse repetition rate. It's very fast, very short pulse duration. Beauty of it, again, minimal mechanical stress, minimal side effects, and you're not going to get this cleavage tissue bubble breakthrough problem. It's mobile, it's efficient, and it's very versatile. We're going to dig into this a little bit more. So it's got a very extreme short focal depth. A lot of the other femtosecond lasers, you'll see the patient's laying down and the laser head's far above. With this, we're actually bringing the laser down to the eye itself. Because the focal length is so short, we bring the laser to the patient's eye. And this has also been optimized with wavefront optics in terms of targeting that laser. Significantly fewer gas bubbles. So one of the things that frustrates me with LASIK is with the older femtosecond lasers I would use, you'd sometimes get an opaque bubble layer. And you've got this opaque bubble layer. If it's central, it blocks the excimer laser's ability to lock on that pupil. So you may do the first part of the flap, and now you have to send the patient out, wait for half an hour for that opaque bubble layer to go away. You never have that delay. You never have that disruption with the Zemer laser. So if you're doing LASIK, it's not going to slow you down. It's going to keep up with you. No opaque bubble layer. Some of the other femtosecond lasers I've used for LASIK as well, some of that bubble breakthrough will cause an air bubble to enter the anterior chamber. That air bubble affects the excimer laser's ability to lock onto the pupil, do pupil tracking. And again, now you've lost the tracker to your excimer. This is slowing you down in LASIK. We don't want to be slowed down. We want excellent results. We want them efficiently, reliably. So, very precise, has different power levels. The thing I love about the Z8 is it is a true Swiss Army knife of lasers. I can use it for so many different procedures, and I'm not forcing it into those procedures. It excels at those procedures. It excels at cataract surgery. It excels at LASIK. It excels at making astigmatic incisions. I can do CTAC with it. It's really a limitless potential to what this laser can do, and I'm not compromising anything. I'm able to do these different things, and I'm not settling for something less. I'm actually achieving something that's excellent. It's excellent at all of these particular surgeries. Why? Has different energy levels. So when you're dealing with the flap, you don't need as much energy. You can use lower energy. You want to be more gentle on the cornea. We're going to see a slide in a minute that shows how that lower energy is safer and gentler on the cornea. But when you're doing lens surgery, you need more power. You need to be able to power light through a cloudy opaque lens to make those cuts. So it has that power. So it has the power when you need it, and it's gentle when you want things to be gentle on the cornea. And this is exclusive to the Zemer femtosecond laser. So I use this laser every single day on my lens side and on my LASIK side. It is my go-to laser. I use it for all my procedures, as do all the surgeons in my practice. How can I do that? Well, I'm building this clinic, and it's a beautiful clinic. We spent a lot of money on aesthetics. We needed to be cautious with how we're spending capital on equipment like lasers. And the beauty of Zemer is I can buy one laser to do both tasks. I don't have to buy a femtosecond laser just for flaps and then a second femtosecond laser to assist me in cataract surgery. One laser can do both jobs, and it can move back and forth through my clinic. Most femtosecond lasers are massive. They're this massive piece of equipment, heavy, completely immobile, and so it affects how much you can bring that laser to other clinics, other locations, other sites within your own clinic. We didn't want to be restricted. We wanted to have that fluidity to be able to bring this technology from the lens side and LASIK side easily. So again, our lens side is on the left, our LASIK's on the right. The Zemer travels back and forth between the two. And depending on the day, the same laser's doing the workload, whether it's a cataract day or a LASIK day. But we also don't want to just move it throughout the clinic. So when we built our office-based surgery center, we have our main OR right now, and then we have a connecting room, and we have a second OR that's been built. Now, it's not being used yet. You're going to see it here in a second. It's not filled out with equipment, but it's going to be. We're planning for success. We're planning for growth. We know we're going to fill this second OR. So why would I put a big, heavy, immobile laser in one OR and not be able to use it in the second OR? With the Zemer, we can simply easily move it between the ORs, And now 1 femtosecond laser is providing the ability to do surgery for both ORs. We don't currently have multiple locations, but most clinics do. And if you've got multiple locations, this is actually a truly mobile laser. Some things claim that they're mobile, but the mobility really is not there. This can fit in a van. If you have a van with a little ramp, you can safely move this laser. The other beautiful thing about this laser is it's not a wilting flower. This is a robust piece of equipment that does not break down. So this is something that's reliable and dependable. I know my zoomer's not going to move down. I can safely move it without worrying about the optics getting disrupted. It is meant to be moved. It's meant to be mobile and versatile. It's operation ready within 30 minutes. So when your staff gets there, they can begin setting it up. It takes 30 minutes to get the laser up, ready for that day's surgery. If the laser's already been warmed up, let's say you've had lunch, it's ready to go. Again, shareable between clinics, departments, locations. It fits with every excimer laser. So what we're seeing here, in one of our LASIK rooms, we've got both the Teneo and we have the Alcon EX500. The Zemer works with both. So on days where I'm using the Teneo, the Z8 moves 2 feet over. On days where I use the EX500, it moves 2 feet over to the EX500. So it fits with multiple excimer laser platforms smoothly and easily. And again, not vulnerable to movement. Truly efficient. It's very flexible. It's very easy to use. It moves well in your hands. We're going to look at a video in a second of how the head articulates. No need to move the patient. The laser moves to the patient, not making the patient move. So you've got a patient for cataract surgery. You've given them sedation. They don't move very quickly. They don't move very well. So don't make the patient move. The laser comes to them and you can adapt the laser in any angle, any height to deal with all sorts of different anatomy. Here I'm just going to kind of show you. And the head comes out. And one of the beautiful things is you can move it up, down, and then it articulates in all directions, 360 degrees. You can have all sorts of tilt because patients have different anatomy. Some have a high brow and I've got to tilt the head back. Sometimes they've got kyphosis and I've got to actually bring the laser in from another angle. The patient can't even bring their head straight up. The beauty with the Zemer is I can use it on all those patients. Anatomy doesn't matter. The laser will let me adapt to that patient's own unique anatomy. Now, it's flexible with lots of different strange cases here. So in the upper left-hand corner, that's a really unusual looking eye. That patient is a +15 patient. I tried to use a different company's femtosecond laser on this patient to make it flap. We couldn't achieve suction. I tried again and again and again. I changed the sizes. It would not work. What it required was me to then bring the patient over to our second LASIK room and use the Z8. And because I can move the Z8 in all directions and rotationally, we were able to get the flap made. So sometimes you've got these eyes that have some crazy anatomy. And when the anatomy is very different and outside the norm, it's beautiful to have a laser that has the flexibility to let you get the task done. Sometimes patients, some patients are a little bit larger, body habitus, and they've got a large chest. Some of the femtosecond lasers from the other companies can't get down. There's a bar that comes down to bring the laser down to the patient. And if they have a large chest, the bar hits and you get an error and you can't go forward with LASIK or cataract surgery. I don't want that. I don't want limitations. So the beauty here is no matter what the patient's body habitus might be, you have the flexibility to bring that laser in from any angle and continue to get that surgery done. I was just going to show folks, if you haven't used it yourself, I was going to show you a little bit, how do we use this here during a cataract case? So you have a ring that comes down on the patient's eye. And what I'm doing with my fingers, I'm giving them a visual target. So I have them focus on my finger. That gets the eye to move. Once the eye is within the circle of the suction device, we can apply suction. And now we've got good suction. We add a fluid interface because we're using more energy on the cataract side. My technician hands me the head, and you can see I can immediately bring this in and dock it. It's very comfortable for the patients. There's not a lot of pressure. We're an office-based surgery center. We're not using IV sedation. We're using oral sedation. So anything that's going to cause excessive pain, they're going to notice. No excessive pain. This is a very comfortable laser, uses low suction. And so here we are, we're going through the screens, has a beautiful OCT image of the eye. This is one of the things I love about this as well. I can see what the eye's anatomy is before I start the case. If this is a very narrow lens, anterior to posterior, I know I'm not going to go aggressively sculpt the first few times. If it's a really long lens, I know I do have to sculpt deeper. So that OCT image is already in my mind. As it's making the incisions and it's handling the cataract, I'm already helping me to plan how I'm going to attack this cataract, how I'm going to attack this case. And here's one of those images. So you get this beautiful image. And the other thing is it's such a beautiful image of the lens itself. Can you see the density of this lens? Am I going to have to use extra power? And so the OCT imaging, I think, has helped me very much plan the surgery. But in LASIK, I want to see where that laser's coming down. I want to know where I'm placing the flap. So there's a camera, and the camera image allows me to see through the laser to see the eye as I go to dock with that patient's eye. Once you've docked, the Z8 has two ways to make a LASIK flap, what's called 2D and 3D. 2D, if you've docked and you love where that flap is, you just go, and it's 5 seconds faster. But if you dock and you say, you know, I think this flap would be optimal just a little to the right or a little to the left or a little bit up. In 3D mode, you can move that flap where you want it. You can shrink it, you can expand it. Sometimes I've got vessels that are growing in. We got a little pannus. I want to avoid that. I can customize where that flap goes and avoid those vessels. So it's beautiful in terms of its flexibility to create the flap size, location, and depth that you want. The other thing I like about it is with that lower energy, I routinely make 90 micron flaps. So patients who are higher myopes, I can leave more tissue behind. On some of the other laser systems, when I tried to make a 90 micron flap, the reliability of those flaps are a little bit less. We'll see a slide on that in a second. And I don't feel safe. On the Zemer, I feel safe every single time making a 90 micron flap. It's not a problem. If you don't want to, you can make 100 micron, 140. You can go deeper, smaller, fully customizable. Now, different interfaces. So in LASIK, what we're doing is using a flat place interface. We're compressing the cornea, and it creates that flap, and it uses less energy. But again, we need more energy when we're doing cataract surgery. We need to drive the laser deeper. We're going through tissues that are not optically clear, so we need more power. And the way they do this is with a liquid interface. And so on the top, you see our liquid interface here. It comes down, we fill it with fluid, and now we have a liquid fluid interface for the cataract portion. But for the LASIK side, we don't use any liquid. We simply come down with the plate, applanate, flatten, and go forward. There's a couple different models that Zemer produces. I went with the Z8 because, again, I wanted this laser to have the maximum amount of flexibility in my clinic. I'm getting into CTAC. It can do that. I do tons of astigmatic incisions. It's great at that. I can make LASIK flaps. I can do corneal transplantation, cataract surgery. And so for me, the Z8 was the right option. But if you're just doing, let's say you just have a LASIK center and you say, I'm never going to use the cataract portions of this. That's okay. They have a laser model that will accommodate that. Here I wanted to show just on the LASIK side, how do we use this? So this day we were working with the EX500. I don't have to change my position. I don't have to leave the laser. I actually use the oculars on the microscope from the excimer laser itself. And here we've docked and we're treating the patient right now. It's very quick, takes about 20 seconds. And then I pass the head off to my technicians. It's versatile, it's dependable, it's durable, but clinically, what do the results look like? This is where I'm really excited, okay? Clinical results. Let's look at predictability of LASIK flaps. So this came from a study back in 2011, and they were looking at all the different platforms that are out there. So we have on the far left, Intralace, second is Visumax, then we have the Zemer, and then we have a Moria M2. And what they found out of all these systems, the Zemer had the most accuracy at producing predictable, reliable depth flaps. I don't want a flap that's thinner than I predicted. I don't want a flap that's thicker than I calculated. This causes problems later. If I'm shooting for 100 microns, I want that flap at 100 microns. Zemer will deliver that better than any laser that's out on the market. But this is the slide that really sold me on this system. So when I'm doing LASIK, the more gentle you can be to the cornea, the faster you're going to visual recovery in your patients. The less inflammation that you have, I think, is going to produce less dry eye. I just think optically, the gentler you are on that corneal tissue, the better the outcome's going to be. What we're looking at is apoptotic stromal cell death after different treatments. And so we can see stromal cell death here. On the left-hand side is a laser from another system. The higher energy makes sense. More energy damages cells. You have more apoptosis. You see more of those red cells lighting up that are showing cells that are dying. Look at the side for the Zemer. One cell. That lower energy is much more gentle to the stromal cells. We have less apoptosis. Dead cells means inflammation, things like DLK. My personal feeling, it's not something that Zemer is going to tout, but I think we see less dry eye because we have less cell death. Dead cells are not a good thing for patients' vision, comfort, or the outcomes. Here we're looking again, better wound healing. And so they're looking at the VisuMax in blue, and that very tiny line in red is from the Zemer femtosecond laser. And this is the number of apoptotic cells within this field from the microscope. Less cell damage, better wound healing. Now, the other thing is, although subconch hemorrhages are not dangerous, we all know they're going to resolve, it's not good for your practice, okay? Someone comes in for LASIK, and the next day, both their eyes are bright red, and for the next week, everyone's asking, what happened to you? That's not good for your referrals. And so for a lot of the femtosecond lasers that are out there, the amount of suction that they have almost invariably is going to cause subconjunctival hemorrhages. The beauty of the Zemer is we never see this. I don't get subconjunctival hemorrhages with the Zemer Z8, ever. So we've got patients that are healing well, they're comfortable, they have precise flaps at just the right depth, and they're not getting this cosmetically disfiguring subconjunctival hemorrhages. The typical disclaimers here about ZA being marketed for CE and FDA clearance. And this was just a shot from ours as we did our 1,000th case with the Zemer Z8 in our cataract suite, so we just kind of wanted to share that with you. I'll be honest, I only speak for products I love. I love the Zemer laser. It's been a tremendous laser for our clinic, very versatile, very durable, and would be happy to answer any questions any of you might have. Thank you.